Hello, everyone, and welcome to this evening's webinar. I am so happy to introduce to you Mr. Kyle Whaley. Kyle graduated from Queen's University Physical and Health Education program and began his career in strength and conditioning with an active population, including athletes from various sports. His passion for adventure and travel took him to a small island in the Pacific, where he worked as a teacher, starting and running after-school programs in the elementary and high school children. After returning to Canada and graduating from physical therapy program at the University of Toronto in 2002, he began his career working in spinal cord injury at Tri-Lyndhurst Centre. His passion for travel has taken him around the globe and afforded him the opportunity to work in Australia and New Zealand, gaining valuable experience and honing his clinical skills in a mix of inpatient, outpatient, and sport environments. Kyle's passion for working with neurological injuries, traumatic brain injury, spinal cord injury, and stroke helped him realize the opening of a private clinic in 2011 dedicated to the treatment of these types of conditions. Kyle co-owned and directed a niche clinic specializing in the treatment of complex neurological and orthopedic conditions. He was specializing in the treatment of complex neurological my apologies. It was here where he continued to further his skills in treating neurological injuries, vestibular disorders, and while growing a busy practice. In 2016, expansion into a larger treatment facility saw the creation of Propel Physiotherapy. Propel offers services that further enhance treatment programs of all kinds of conditions, neurological and orthopedic, in order to reach the physical potential of their clients. Kyle's career has focused on the treatment of traumatic brain injury and spinal cord injury. He has spearheaded the use of cutting-edge technology at Propel, including the Kyogo robotic-assisted walking device and the PoNS portable neuromodulation simulator. Kyle is the owner and executive director, as well as practicing clinician at Propel Physiotherapy. Kyle is an adjunct lecturer at the University of Toronto in the Department of Physical Therapy and lab clinician for both the MSCPT and Ontario Internationally Educated Physical Therapy Bridging programs. He spends his downtime with his wife and two boys on the ice, bike, water, ski hill, or in the woods. Welcome, Kyle.
Thanks so much, Melissa. Whoa, I thought that was the short one. Just kidding.
I was waiting for the blare.
Yeah, holy smokes. Thanks so much for having me. I'm gonna get right into the presentation, and I think I've got controls right now. As Melissa said, share. Just give me one second. Is that it?
You got it.
It looks like I can only share a portion of the screen. Let's see what that looks like. Is that showing all the presentation?
It's a little bit cut off on the edges.
It is. Sorry, give me one sec.
Okay.
My options, Melissa, are slides as a virtual background, portion of a screen. Oh, no. I got it. My bad.
Let's see. There we go.
How's that?
Perfect.
Great. Sorry, everyone. Technical difficulties. Before we start, just a quick heads up. I am at home here. There's kids and dogs. I've tried to keep them all out, and I'm going to try and continue to keep them out. As the sunlight goes down, I may have to run downstairs. It looks a lot better with the light coming in at me than this bulb light behind that's in our room. But as Melissa mentioned, please feel free to enter questions into the Q&A and stop, and we can chat along the way, or make notes and put your questions down, and I can try and answer them a little bit later. We don't need any more introduction into who I am. I'd like to start with a couple of quotes. One from Martin Luther King, and the second, my favorite, from Bob Marley. One good thing about music, When it hits you, you feel no pain. What did we do at Propel Physiotherapy? Melissa covered a good chunk of it in my short bio. We're a treatment center that kind of specializes and has a special interest in the treatment of neurological injuries. We have physiotherapists, kinesiologists, massage, yoga therapy, mindfulness, and a host of other treatment providers and treatment modalities. I'm going to talk today about brain injury physiotherapy and neuroplasticity. A lot of people have heard about neuroplasticity. We'll go over it in maybe a little bit more detail, but certainly not too much, and try and provide a couple of real world examples. The objectives of the presentation today, we're going to discuss some common physical and neurological issues arise after a TBI or an ABI. This is going to be all, none of this is going to be educational or news, that part to you. Everybody, survivors, aware of that. I'm going to outline how physiotherapy might help after traumatic brain injury. Some of you may or may not have had physiotherapy. We'll talk about how neuroplasticity, what it is and how it works. And then we'll present on, I'm going to talk a little bit about some cutting edge technology we have for the treatment of traumatic brain injury. After brain injury, this is not an exhaustive list, but many of you are aware of headaches, pain, soreness, some balance challenges, dizziness, fatigue, trouble with movement, and all of these coupled together can challenge your day-to-day functioning in your family and your work and your certainly your recreational life. Some barriers: pain and soreness and headaches certainly can put a halt to the day mentally and physically, and prevent you and challenge you many times into participating in regular activities of daily living, if you will, or just things you may have done before on a day-to-day basis. Some of the strategies we use in physiotherapy are, some people are certainly banged up after a traumatic brain injury, and we will do manual therapy. So working with our hands to loosen some of the joints in the neck, or the back, or the hips, the knees, the legs. And we try and start everybody on a movement program. We know movement is good for the body, and exercise is, even as a whole, is really important. I'll talk about that a little bit more. It can certainly help with pain and stiffness and energy, pacing, energy conservation, and some education on activity and pointing in the right direction on which exercise to do, which activities to do. Another big approach we use is mindfulness meditation. We used to call it, when I was in school, it was called deep breathing and relaxation. And we didn't know a lot about it, but we knew it was quite helpful in calming the mind and therefore calming the body. And we know now there's some great literature for mindfulness, and that can take the form of many different things. So balance, challenge with balance, dizziness, and a lack of mobility or immobility. So that can lead, one of the barriers is a fear of falling, and poor balance can lead to this cycle of inactivity and limited participation in stuff you would normally be doing. Again, with friends, family, or part of your therapy. And what we do again is try and start an activity or an exercise program that's novel and challenges balance exercises. And tailored, it's really set up for each individual depending on their particular deficits, because as we know, no two traumatic brain injuries look the same. We may be prescribing appropriate gait aids and footwear and orthotics, and gait aids are crutches or canes or walkers, trekking poles. We want to challenge your balance system. I was working with a client today with an acquired brain injury. We had him in a bodyweight support system that if he were to fall, it would catch him. And I was pushing him around, working on his, what we call stepping strategy, his reactionary balance strategies to keep him upright. And certainly, some of us may experience limited strength or endurance. We're just not strong enough. That could be from the brain injury. It could be from kind of peripheral injuries, fractures or breaks in the bones, or dislocations and breaks in the joints, or damage to the nerves that go supply the arms and the legs. That can be a real barrier to participation, especially the constant feelings of weakness and fatigue, which are quite common after a traumatic brain injury. And we really, again, adapt that custom program, and we may change the time of day when you've got the most energy to do it, and we certainly try and do it in small doses. So, really pacing on what that looks like, and use the analogy of gas in a gas tank. We don't want to empty all of the gas tank with your physiotherapy program, and you go home, you've got nothing left for your family or your friends. We also do group programs and try and make sure they're consistent, and they're directed and really driven by the client. And I think my colleague put this in, it's really important, is small gains over the course of time can lead to big results. If there's one thing that differentiates us as neurophysiotherapists from our colleagues that really treat strictly orthopedic, like sports injuries and sprained ankles, and not a traumatic brain injury, the big difference is as neurophysiotherapists, we're looking way down the road, months and years. We're not looking 2 or 3 weeks down the road at discharging somebody from treatment because they're going to be all better. It takes a lot longer than that, as you know. Emotional dysregulation and mood, and this is obviously depending on the parts of your brain that are affected, and certainly the pain you have after it can certainly change your mood, and limit your interaction with others, and again, this participation in daily activities. And this is where that mindfulness comes in. We use activity logs and independent programs to help improve the overall quality of movement, and therefore quality of life. Some of the other things we'll do is yoga therapy and hydro or aqua or water therapy. So some of the benefits of exercise, I did a talk to the Brain Injury Association of Peel and Halton probably 15 years ago. And I remember I had 2 slides and there was probably 40 things on each slide. I had 80 in 2 slides. It was crazy. It was way too much, and obviously nobody could read anything. So I've tried to cut it down to a couple of slides and to really highlight some of the really good stuff. Benefit of exercise. Exercise, we know from studies and looking at the science, it improves your mood. There's lots of lovely chemicals that are released in the brain that are feel-good chemicals, and those come out when you exercise. And that doesn't have to be running the marathon. People always think of the runner's high. No, you can get that from just walking. Weight control. We know that carrying too much weight isn't healthy, and 2, a lot of the time it doesn't make us feel good. It might hurt the joints, and you just don't feel great about yourself, and therefore you're less likely to exercise, and that starts a little bit of a cycle that can be tough to break. And the part that I love, and it's easy as a physiotherapist, is there's only a couple of conditions ever where we wouldn't prescribe exercise, because we know it combats almost all known diseases, both physical and mental. And it improves, here's a really important one, the body's relaxation response, or the parasympathetic nervous system. We got two main branches of our nervous system. We've got a fight or flight, and then we've got a rest and digest. And the fight or flight is the sympathetic, and the rest and digest is this parasympathetic, where we really get to relax and calm everything, the body and the mind down. And it improves our cognition or thinking, so memory and attention, and as well as our what we call mental acuity. I got another page. So we talked about energy, so less fatigue. You can get stronger after you're doing resistance training, and that allows you to improve your day-to-day function. It can improve your sleep, improve sexual dysfunction, which is important. And it's our first line of defense for chronic, or what we now call persistent pain. If I'm going too quick, somebody just pop something in the chat box or Q&A, or if you can't hear me clearly, let me know. So I'm going to introduce the concept of neurogenesis, and that just means the creation of new neurons or nerves. And connections, the creation of the connections is synaptogenesis. That is the fundamental basis of the point I'm going to get to shortly, which is neuroplasticity, or the ability of the brain and the nervous system to adapt to a stimulus. So neurogenesis, exercise helps build more connections in the brain. And again, what is neuroplasticity? There's a lot of different complicated descriptions out there. This is one I really found is probably the easiest to digest. It's the ability of the nervous system, which is the brain and spinal cord injury, the brain and spinal cord and all the peripheral nerves, to change the way it works or its activity in response to stimulus, either coming from the inside or outside, by reorganizing itself, the structure, so neurogenesis, creating new nerves, the function, how efficiently the brain works, and then certainly the connections, the synaptogenesis. And there's something very important to remember here is, if you'll notice, this definition doesn't use the words good, bad, positive. The brain, neuroplasticity is a response to a stimulus, and that can be a beneficial stimulus like movement and exercise. That can also be a stimulus that's what we call maladaptive or not helpful. We use the term maladaptive neuroplasticity. A great example of that is chronic or persistent pain. So if pain goes on too long, the brain gets used to that cycle of triggering pain, feeling it, and perpetuating itself. Those nervous tracts tend to reinforce themselves. That's what we call maladaptive neuroplasticity. The same can go for our thoughts. Some of you may or may not experience, you're on your, I'll give you an example. I'm on my way, I'm biking to work today, and a car runs a stop sign right in front of me, just blows right through it, misses me by about 10 feet. I spent the rest of my bike ride, concerned, and I was also pretty upset and stewing, kind of grumbling to myself as I biked for the next half an hour about how that person cut me off and could have hurt me. That can perpetuate those thoughts on a regular basis, negative thoughts and negative emotions. If we've been on that cycle before, they just keep going. That's probably a similar idea of reinforcing connections in the brain that aren't helpful. I've got a video here I'd like everyone to watch. It's about 2 minutes long. There's a lovely Australian accent. If for some reason you can't hear it, I'm not sure the audio is going to come through, but somebody just let me know if the audio doesn't come through and we'll move on.
Okay, do you want to try unplugging your headset?
Can't hear it, Melissa?
No.
Dear. My bad.
That's okay.
I don't know how to share audio. That's okay. I will include a link to that when we're done at the end. We're making good time. This is the 7th inning stretch. My colleague put this in. Everyone have a quick stand up. If you can't stand, sit high in your chair or roll over in bed. We're going to do a quick couple of movements. Physiotherapists, it's really important. Sitting at the edge of the chair, slouch, sit tall, shoulders back, slouch again, sit tall, shoulders back, Deep breath in as you sit tall. Exhale. Hands behind the head, if you can. Reach up tall and lean backwards like you're yawning. Down, up and reach back as if you're yawning. And we'll do a couple of sit to stands and then we'll move on. If you can get to the edge of your chair, if it's possible, stand up and down. If not, stay in your chair and lift your arms up over your head, you can, or as high as you can go. Up, down, up, down, up, down. Lovely. Okay, so we know neuroplasticity is the ability of the brain to reorganize itself to a stimulus. And we've got some cutting edge technology. It's actually old technology that's been repurposed recently. And we use it for the Propel Physiotherapy. We use it for the treatment of mild traumatic brain injury, as well as multiple sclerosis, which is a condition some of you may have heard of. And it's really interesting. It's a portable device that uses a gentle current through a tongue stimulator. And that, coupled with a really intense 14-week program that combines a walking or gait training, balance training, and some mindfulness, has been shown to improve walking and balance in people after traumatic brain injury. It's called the PoNS, or Portable Neuromodulation Stimulator. And how this works, or the theory of it, is this is the tongue stimulator here that sits gently on the front part of your tongue. And there's a couple of nerves that the tongue connect to, the trigeminal and the facial nerves. Those are called cranial nerves, and they attach in the middle of the brain. Okay, we got a quick, looks like a question here, and I can't pull that up.
So
can you see that?
I was having a hard time unmuting myself. My apologies.
No problem.
So one of our members is just asking, I think we've all heard of fight or flight, but what about frozen? I've read about freeze being called appease, to give in, not fight, but that's not the same as not physically being capable of doing anything, or our brain freezes. Do you have anything to say on this?
That's a really good question. My OT colleagues, occupational therapy colleagues, would probably be able to best answer this. I don't know a lot about the freeze or appease. Is that with respect to not kind of, yeah, I'm not sure. I don't want to guess. I think the fight, I don't have a, I don't know a lot about that, so I probably shouldn't say much, but I think the fight or flight, really the take home there was those two parts of your nervous system. And it sounds really interesting, this other part, but is, it can be discussed later. Lovely. Yeah, really just the sympathetic or fight or flight, too much of that releases a number of chemicals in the body that aren't good. And so we usually try and flip that switch. We can chat about that maybe a little bit more towards the end. So anyways, the theory of the PoNS is it stimulates the tongue. There's a couple of nerves that go and attach in the midbrain here, or what is called the PoNS. And PoNS is Latin for bridge. It's the bridge between the upper part of the brain and the lower part of the brain that goes down into the spinal cord. And moving through the PoNS are a lot of spinal tracts that take information kind of down to the body to move, and other information that comes up for processing in the brain. And the idea is that this gentle stimulation, primes the nervous system for moving information along those tracks. So learning, or neuroplasticity. And the program is, as I mentioned, very intense. It's a 14-week program it's about an hour twice a day, and it runs 6 days a week for 14 weeks total. And again, there's walking, balance, mindfulness, and there's some specific physiotherapy exercise. This is one of our clients doing a higher end challenge task or balance task on, that's a Bosu ball that's turned upside down, creating an unstable environment. And you can see up at the top, he's got the unit around his neck and the mouthpiece is in. This is just a quick schematic of it. We take assessments at the start, at 4 weeks, at 8 weeks, and then finally at 14 weeks. And again, the program we're doing, it might not be a lot different from a regular physiotherapy program we do. It certainly combines components of that, but the intensity of the program coupled with the stimulation has really shown some excellent results. I'm going to present a case here, a client who just finished the 14-week program with, who's had a mild traumatic brain injury. I don't want to give this disclaimer at the start of this. This is a one-off case study. This doesn't represent studies or literature that we're presenting. This is just a case study, and we can't make generalizations about everyone. This was a 55-year-old lady, a client of ours, who had a ceiling in the shower fall on top of her head back in 2014. While she was showering, she fell back and hit her head on the edge of the tub and sustained a mild traumatic brain injury. She had a past medical history of mental health conditions, bipolar, depression, and anxiety. And she's since developed post-traumatic stress disorder. She's living, she couldn't go back to the apartment. She's living with her kids, has very little engagement with the family and grandchildren, and is in some significant pain, even 7 years down the road. She came to us 14 weeks ago using a 4-wheeled walker, and she was walking short distances, and she couldn't get her left heel down on the ground. This was a very good example of how entrenched persistent pain can be. And she just literally, every time her heel hit the ground, she would just scream out in pain. And her left arm, she had barely moved it for 7 years. And this is a picture of what we call these maladaptive pains. So these thoughts about pain and lack of movement had just turned into this monstrous cycle that she couldn't get out of. And she was, in her words, willing to try anything at this point. Her goals, she wanted to stop dropping bottles and dishes. Her coordination and the strength of one of her hands was certainly limited. She wanted to walk on her own without a walker, and she wanted to improve her overall strength. Bear with me, I've tried to keep this as simple as possible. And here's the results. Pre is before the program. And you can see our assessments at week 4, 8, and at the end at week 14. The 10 MWT is 10-meter walk test. And that is strictly a measure of your walking speed. The first one is up here is your regular walking speed at a regular pace. This is as fast as you can. And just as a frame of reference, normal walking, it depends on the literature you read, but people walking across the street usually walk at about 1 to 1.2 meters per second. So she was walking at 0.6 meters per second. And you can see the numbers progress. And by the end, her normal speed was 1.6 meters per second. So certainly she was well above. And she actually, by the end of week 5 or 6, she had gotten rid of the 4-wheeled walker and was using trekking poles. And by the end of, I think, week 10 or 12, she'd stopped using the trekking poles. and she wasn't using anything. And then her fast speeds, you can see have increased. The functional walking, there's a measure, outcome measure we call the FGA, or functional gait assessment. And you can see her scores over the 14 weeks. You know, she maxed it out and scored perfect by the end. And the Bird balance scale, balance test we do, she'd done very well and got to the top of that by week 8. And this is a feel-good story. She'd really achieved 2 out of the 3 of her goals. She was still dropping some of the dishes, but she'd certainly improved the strength of all over and was continuing to improve. And she's motivated to continue. She's got another round. I can talk about that a little bit after, but she feels like she's got a lot more improvement to make, which is great. And something important, I think, to notice here is her language and her thoughts around pain have changed. So pain was, you know, she said something to me at the end of the 14 weeks, which is very important. She said, you know, I still have pain. I'm just able to manage it better. And that's, as physiotherapists, that is our goal, really, with chronic or persistent pain. You know, pain that lasts longer than 6 months to a year. We're likely not going to get rid of it, but we want to be able to give you the tools to manage it. And really, it was exercise and movement that helped her manage this type of pain. And I would be remiss if we didn't put something at the end here of some of the challenges to accessing advanced or cutting edge technology. I'm going to blanket that with accessing care, any type of therapy after you discharge from our public, what we refer to as our public system. So, you know, if you're in acute care and then rehab, and once you're discharged home, you know, our all-encompassing private healthcare unfortunately doesn't cover most of the treatment that you need. And I don't need to tell you guys that. Everyone's probably well aware of that. I'm going to try and give you some really basic tips, and I'm certainly happy to discuss them later on how you may be able to access or certainly make what dollars you have go further. Because therapy, and I own and run, you know, a number of clinics. I understand wholeheartedly how expensive any type of therapy is. It's very challenging. You know, the first one I say is ask for a discount. So if you don't ask, you don't know, really, is the way that goes. And I would not be afraid to ask the therapist or the manager, depending on where you are. And this goes for anything. Anybody can provide a discount. As the owner, again, and executive director of our clinic, I am the one that does the kind of the pro bono or complimentary or discounted therapy. And I think it's really important. I think there's a large group of the population that don't have access to appropriate therapy. And, you know, I don't ask my therapist to do that. I do that myself. So the March of Dimes, some of you may have heard of, is a excellent organization that can help out with funding of all different kinds. You know, it tends to focus on equipment, but they can certainly do, you know, like wheelchairs, scooters, and walkers, but it can certainly do other types of funding and possibly sometimes therapy. The third one I've put up here is a Gofundme campaign. And the reason I say that is the case that I just presented, that lady did not have the funds to access the PoNS program. And with the help of a friend or an advocate, I should say, she was able to do a GoFundMe campaign and raise enough in a couple of months to cover the whole program. You know, 5-10 years ago, I'm not sure that would have even been an option, but I see more and more friends and colleagues, and we have clients and patients that are doing the same. And lastly, the point here is pretty straightforward, but, you know, if you have a partner, a spouse who's, you know, working and has benefits through work, obviously some therapies can get covered. Accident benefits, if you've been in a motor vehicle accident, it's important to talk to, you know, your insurance company or your treatment team or your lawyer, obviously, for different types of funding. And that's straightforward. Should be once you get in an accident, or the Workers' Safety Insurance Board, or WSIB. also provides coverage after an accident. And lastly, one I should have mentioned certainly is OHIP. So, and if you're on Ontario Works or ODSP, OHIP physiotherapy programs of care should be covered. They tend to be limited and likely don't cover expensive pieces of equipment. However, that is an option to accessing treatment funds. Thanks so much for listening. I will share, well, this is going to be recorded, and I will share the link. Make sure I get Melissa to send out the link on that short video on neuroplasticity. It's really good. It's great to have as a reference to go back to. I use it all the time. It's got some really, really interesting real world examples. Thanks so much.
Thank you so much, Kyle.
Pleasure.
You know, even at the end when you talked about you know, ways to make access a little easier, you know, how incredible how, I mean, I didn't even think about some of those ideas. And you know, with social media especially being so accessible, even if you yourself don't have an account, if you have a friend or a family member that has an account, they can set up a GoFundMe on your behalf. And it's so simple, but yeah, to be honest, I mean, we've had a few webinars where you know, access wasn't the easiest, we'll say, just to put it mildly. But even then, I hadn't even thought. And so, what a great set of strategies just to make it, you know, easier. I mean, like it's already so challenging, but to have so many strategies that are, you know, available and relatively easy to do, either on your own or with a little bit of help. It's so fabulous for you. You know, thank you for bringing that to our members.
Oh, my pleasure. And I think you guys, I'd be remiss if I didn't talk about you guys, Melissa, doing such a good job advocating and providing resources and stuff to clients. Like, it's really, really important to kind of reach out. There's so many different ways to access care. And I can't stress enough the first one I said, like, don't be afraid to ask for a discount. You know, like, really, you may or may not be surprised, but there's places out there that'll say, look, you know, I'll cut, like, what are your goals? Here's what I think you need. Here's where we can get you. How much can you afford? So,
yeah.
I see a question here. How much does PoNS therapy cost? Get this therapy, no one has far known. Okay, I'll read this out loud. How much does PoNS therapy cost? I've asked a number of TBI related doctors about this therapy, and no one so far has known about it, including this supposed top neurologist, Sunny. So that's a really good question. So the therapy is expensive. The device itself, which is sold by the company, and they decide on their price points. The device itself, which, you know, shipping that device, including the mouthpiece, is just over $5,000. At the end of that, you keep that's yours, you purchase it. And what happens is at the end of the 14 weeks, the mouthpiece stops working and you need to renew and buy a new mouthpiece, and the mouthpieces are $500. I'm not sure the company's decisions on this. It's likely a bit of an insurance policy, so nobody takes the mouthpiece, and you know, I'm not totally sure, but and it's also not suggesting you need to do this once you've done it once. You need to do it ongoing. Like, you make benefits and it gets you into the place you need to be. You know, we usually have people move on. None of the TBI related doctors know about it. That's a very good point. And, you know, that's not surprising. It's relatively new. So I can tell you one of the challenges for the company, as I mentioned, the technology is old. It's been around for a very long time. It was a Russian fella that kind of pioneered some of the early research. The company relaunched it in Canada and got Health Canada approval right at the start of COVID. So, yeah, it has not been accessible really to a lot of people for long. And part of that is the time on the market and getting points of contact with physicians and getting the word out and educating everybody else. It's not a miracle. It's not a panacea, but again, it can be very helpful. And there's some good studies that that have been done to show that. But yeah, no, I'm not surprised. But would it help with the nervous system dysregulation? That's a really good question, Charmaine, I think it is. That's a great question. So the company, there's some benefits that have been measured and studied, and the company, especially in Canada, can really only say that the device is going to help with that. And that's understandable. And that's an appropriate way to message to give. You know, it can be helpful in balance and walking. However, I can tell you, with speaking with a number of my colleagues, there's a number of clinics across the GTA that provide PoNS. People have noticed all different kinds of improvements in different areas that are not related to balance and walking. Definitely kind of nervous system dysregulation. We finished with a client. He just said, my thinking's a lot. And again, I'm just giving testimonials of what people said. This does not mean it's going to work for each individual, but some people, things I've heard is my thinking's a bit clearer. I'm sleeping better. I'm just a lot calmer. Yeah, there's a number of different things that people have discussed that it's helped with, apart from just the stuff that the company describes as on label. And if you want more information, the recording, I'm sure Melissa's gonna share. We can set up a complimentary consultation, 15-minute consultation. There's no charge, just to talk a little bit more. We hook you up with one of our, either myself or one of our other PoNS trained therapists, to discuss kind of, you know, where you are and what your goals are and what your current symptoms are, and whether PoNS is even going to be appropriate for you. It may or may not be appropriate. Maybe something else, you know, that we might be able to recommend that could be helpful.
Perfect, thank you. Okay, in the Q&A, I have an anonymous question. Is it normal for a therapist to charge a client for communication with a client, such as emailing or calling?
That's a really good question. I see that one. So that really depends on the company and how they lay out their stuff. You should certainly be made aware of that before that happens. I can say at our company at Propel, if there's funding for that. So an example, if you had a motor vehicle accident, we would submit a treatment plan to your insurance company that would cover a certain amount of allot time for communication with other healthcare professionals, then we would use that. But otherwise, without you knowing, no, I would ask some questions, and we don't charge unless one of our therapists explains up front. We're not going to charge for talking to, you know, we don't charge. I send a note to doctors all the time. I don't charge for sending a note. And if I did, I would certainly let you know before I wrote the note.
I think that's kind of similar to a lot of family doctors or general physicians in terms of forms and stuff. But yeah, I mean, usually you would be told ahead of time. And so it's,
yeah. And you know, our group of our clientele, as I mentioned, tend to be neurological injuries, so brain and spinal cord injury. A lot of them aren't working, excuse me, which is understandable, and money's tight. We understand, and we tend to run, you know, our answer to that I mentioned is I do the pro bono work or the complementary work that people can afford if they need it. We try not to turn anyone away. We've also got lots of group sessions that are really a reduced cost. Some of them are virtual, where you participate in a group and it's, you know, it's $15, $20, $25, $35, something like that. But again, don't be afraid to ask for a discount.
I think especially in our society, I mean, we're in North America, we don't ask those types of questions. We don't talk about money because it's very uncomfortable. And so it's great to even put that out there that, you know, we still can do that. I mean, like, nobody's guaranteeing, you know, that there will be a discount or that there will be something, but at least the option is out there, you know, and not being so afraid, and just kind of, the worst thing that can happen is you get a no. And that's okay, you know, and maybe even just move on to the next person, or, you know, but yeah, but I love that you're just so, like you're really kind of driving home that, those, you know, points of accessibility, you know, which is so important, you know. And I think a lot of people, not just our members, but people in general, especially in a place like Toronto, you know, we don't want to seem a bother. And so we try to be very quiet and very, you know, go with the flow. And that's not always to our best advantage.
Exactly. If you don't, the squeaky wheel gets the grease, pardon the expressions. Like there's no, and again, I want to reiterate, if we can't help you, there are also some great publicly funded programs out there that we're in contact with. Yeah, we try and do the legwork to help you find those.
That's incredible.
I see another, how do you, and I'm just going to pull this over and I'll read it out loud. Unless you want to, Melissa, sorry about that.
Whenever you would like. We were kind of doing a little back and forth, weren't we?
It's great. Oh, here we are. Okay, this one. How do you advise clients with a TBI or a mild traumatic brain injury about how to successfully submit an insurance claim? It's tricky since these injuries are invisible and it's hard to measure even for ODSP, et cetera. So with that, that depends on if it's an insurance claim through kind of motor vehicle accident or like a slip and fall, or work. It really depends. So it depends on where and how you're injured. What we usually try and do is, you know, help. Part of it's I'm not going to say a necessary evil. I almost said that. In today's day and society, what lawyers, there's some really good lawyers out there that can help get you funds if your case is one, depending on how you were injured or hurt yourself. And you know, that's probably a point in the right direction is really good. If you're really injured, depending on, you know, we try and work with you to communicate with the particular insurance funding system, whether that's, you know, ODSP, extended health benefits through work, or motor vehicle accident or WSIB. You know, we'll get on the phone on your behalf and help advocate for you. It's been we've been doing this for, you know, I've been practicing for almost 20 years, and I have a full team actually that does that as well. So, yeah.
That's pretty incredible.
Yeah, I hope that answers your question. It really, yeah. So ODSP can be a real challenge, and we understand that wholeheartedly. We have the challenge with ODSP is technically, you know, their first line is to send you to a OHIP physiotherapy, which, you know, it's just a different funding model, and you know, many times they don't have access to and this isn't all the time or a hard and fast rule, but they might not have access to some of the equipment and the resources that we have, and certainly wouldn't have access to some of the stuff you would see in a hospital, acute care, or rehab. And that's really just a dollars and cents. It's a funding. They're just not funded enough. You know, a lot of program episodes of care through OHIP physiotherapy, they cover about $300 and some. So, I mean, an hour at our clinic is $135. So it's challenging out there.
Mm-hmm. I think that's part of why, you know, it's so important too to bring a lot of this to the forefront, and call attention to it, because, you know, as we all know, as things become just more available, they become cheaper, they become more accessible, you know, and it is that older technology that tends to be covered. And so it's that little trick, like, how do we make this old technology, like, you know, and it really is just, you know, get it out there, you know, and call attention and make it something that is just very, like, a very typical treatment, you know.
That's an excellent point, Melissa. Like, Just so true. If we can get it out, and usually the price comes down. Well done.
Okay, so that's
Yeah.
one of these.
That's why I'm here. That's why I'm here. And I also want to, I'm going to give a shameless plug for Friends and Family for Safe Streets. It's a lovely organization that does bike advocacy for for road violence. And some of you may or may not have been injured while cycling. And we really want to lobby the government to change just accessibility for cyclists and make roads more just safer for all of us. I see another question here in the chat, and if you don't mind, I'll read it out. What if my situation was actually where I had a collision with a goalie in my soccer game? Signed a waiver for the soccer league, which was an independent young adults league. Additionally, I wasn't working or in school, didn't have a car accident. So do I fit in the criteria for funding? That's a really good question, Anne. And that is actually a question for, it's a great example of what I just spoke about getting good legal advice, because that's way above my pay grade and would be out of my scope of practice. But that may or may not fall into what we would call a slip and fall. You were injured, it wasn't at work, it wasn't in a car, and the details of the waiver is really something that that a good lawyer could read over and advise you, certainly on a complimentary basis, on whether you had a case or not, maybe what to do. If you want to, I think, Melissa, you're going to give my contact information. Yeah, it's all on the slides. Give it after.
Yes.
As long as my email's there, it's really important. Feel free to send me an email, and I can point you in the right direction with some law firms that we work with that do really good work and can tell you yes or no that this isn't something that we're going to be able to help you with, or maybe you need to go somewhere else.
That's I'm smiling because I'm starting to think you're a little bit of an advocate yourself, Mr. Whaley.
Oh, I enjoy it. I mean, it's just been so long we've been doing it. So, and we understand our clientele. We understand how tough it is.
And it's so important. I mean, I think that really makes the difference between, like a clinician and somebody who treats people,
Oh, so true. Oh yeah, no, we recognize the disparity. It's ridiculous. It's ridiculous. You get, we always say that, the best, it's awful, but if you're going to get seriously injured, your funding is going to be totally different if you get injured in a car, you're on a bike and you get hit by a car, or certainly at work with respect to access to your treatment. So it's a public universal healthcare doesn't mean everybody has the same access. I think is probably, it's taken me many years, but I understand that inside and out now, unfortunately. Yes.
Now, somebody has just said that she's acknowledging that you're very generous.
Oh, lovely. I haven't looked at the panelists list. I spoke a number of times, and certainly for BIST on behalf of other brain injury associations. I'm happy to do this. I enjoy it. I'm in a super fortunate position that I can give back, and I'm happy to do it.
That's fabulous. See, virtual hugs all around. It's
real ones are coming
incredible.
up.
One of these days, right?
Yeah, I know. I know.
See, if only I could reach through. I'm gonna drag you over the picnic. It's you're like, oh, it's
yeah.
Boy, but that's exciting. Yes, and everybody, we're talking about the picnic tomorrow, and
great. Yeah. I hope it's awesome. The weather's supposed to be spectacular. I see Bernadette, you mentioned eligible doesn't mean qualify for treatment, and that's so true as well. That's so true. Many of these insurance and funding providers, whether it's car insurance companies, work insurance, listen, you know, you talk about advocate, that's 20 years of me on the other line of a phone talking to, you know, an adjuster and, you know, getting heated and getting frustrated. I do it on a weekly basis. And if I can give, and this is maybe cold comfort, but a lawyer said to me once, it was fascinating, said, you know, I look at the relationship I have with these insurance adjusters as I have information that I'm trying to get to them, and I'm a teacher. I just need to show them the right way. And I've taken that, you know, it's like a lot of these people that are making decisions about your money are not healthcare professionals, which is really challenging. And I can't imagine how challenging that is from, you know, from a client or survivor's perspective. And I see it with my clients. They're angry, they're frustrated, they're fed up, you know, and I don't blame them. And you know, I always I put a smile on when I start that conversation. And I think, look, I'm a trained professional. I went to school for 7 years. I've been practicing for 20 years. My job is to hold their hand and show them why these people, without a doubt, need the treatment that I'm proposing. And, you know, most of the time we're successful in doing that.
What a great perspective, though, that he brought. I mean, because it is so easy to get, you know, angry and frustrated because it's. I think that sometimes it's we don't recognize that you know, those doctors and those people who are in the healthcare field, they feel those same frustrations at a different level, a different reason behind it. But it's frustrating because you're not there because you don't care. You're actually there because you want these people to be successful, you know, to their greatest potential. And without these little pieces, you know, fitting in, they're not going to reach that potential. And so, you know, it's so easy to get on that phone and just, you know, try so hard not to, like, don't yell, like, don't raise your voice, but you realize I'm there already. And that perspective of, you know what, they don't know any better. You need to come in and you just need to explain it to them, you know?
Yeah, I can feel my sympathetic nervous system already. It's like just telling those stories. I'm like, oh.
I know, it's like your whole body buzzes because you're like,
it just,
you know, keep the cool, but
I know, and it's so frustrating. It's so frustrating. And you know, I to come back to what you just reiterated, Melissa, is just, I try and have perspective every time I go in, but it's difficult. I think really finding, you know, an advocate or somebody who's in your corner that can help you. So, and that may or may not be a physiotherapist, could be a family doctor, could be just a friend.
Yeah.
You know, or a number of friends or an organization like the group you guys set up. You know, really the advocacy work you guys do is spectacular. And it's important to be empowered, especially when it comes to your healthcare. Like there's nothing more important than feeling like you're helpless in the access of treatment that you know is going to help you. That's why I put that Martin Luther King up, the quote at the start is, you know, of all the injustices in the world, there's nothing more than inequality in healthcare. And really, you know, the fact that we're having this conversation, you know, in 2021 in Toronto, the fourth biggest city in North America, and, you know, we have a very high standard and quality of life here in Canada, I think is mind blowing.
Yes.
And people don't know. People don't know that. So I don't need to tell all of you that. You understand it. You're likely living it. So.
Mm-hmm. Yeah, it's so true. I mean, it's funny because I was not with a member, but with a personal person a personal person. I just said that. But we were talking and she was just kind of telling me her own frustrations. And I said, you know what? I hear that from everybody. I said, and I'm so tired and now granted, this was coming out of, you know, I was forced to sit and watch CP24 with all of the, you know, the sports, you know, people being traded and, you know, how much money they're making. And so I kind of like just, I kind of just burst out and I said, you know, I'm so sick of hearing this in a time where I'm hearing people making millions and millions of dollars for tossing a ball, for, you know, I mean, like, yes, it's entertainment and I understand and it's fantastic if you love it, but it's not worth that. You know, your quality of life is worth more than the entertainment that, you know, you have access to, you know.
Totally.
And it's just so mind-blowing to me that we will spend billions of dollars on entertainers, but we don't spend that money on our citizens, you know, in healthcare. It's just, it's so frustrating. I can't wait till one day we're not having this conversation. You know, I can't wait till I'm just like, you know, hey, you know, first phone call of the day. Yeah, just, you know, let me hook you up with an appointment because it's that easy, you know. That's what I hope our end game is.
I can't wait. Yeah, exactly.
Yeah. I'm just wondering if anybody else has any questions.
We finished, oh my goodness, we've done the presentation and the chit chat in an hour.
I know. What happened?
I try and be efficient. We're losing light here. The shine off my head is going to be gone in about 20 minutes.
I joke that throughout the evening I change different colors. And so right now I'm pink and then I'll turn purple in a little bit.
Oh, that's funny. Oh dear. Okay, we got another. Do you provide a different therapy approach for a client who has whiplash or concussion compared to one that's recovered and improved in cognitive pacing with their concussion, though they still have the whiplash? The symptoms may manifest the same. So how do I know if I'm getting the right treatment? So different approach. So for a client who's whiplash or concussion with a, okay, so you still have the concussion whiplash symptoms, but your cognitive pacing is improved. Yeah, you know, we're really going to target, it's the tailored or the customized approach. And that's based on the assessment that we do. I can speak in general terms on how we would approach something like, yeah, how we'd approach something like that. So we would do, you know, based on the assessment, we're looking at the musculoskeletal or the joint portion in your neck. If you still have pain, I mean, whiplash is going to recover in a handful of weeks and certainly months. And if it, you know, if it doesn't, what usually is going on is what I spoke of before is persistent pain. So there's at the tissue level, things have healed. There's just something feeding into that pain cycle that continues. It's like, oh man, my neck still hurts. So it may be manual therapy that we do. We also, the exercise portion that we do for our concussion, mild traumatic brain injury, the assessment, there's a really big piece. We call it we don't call it, it's called the Buffalo Concussion Treadmill Test. It was developed by a researcher, Letty, out of Buffalo. And really what we do is we walk you on a treadmill and increase relatively fast, and we increase the incline so that your body and your system starts to work. And we monitor your symptoms. And if your symptoms start to, you know, go up, there's a cutoff point, we stop it. And then what we do is we back up about 20% off that cutoff point, and we have you exercise at those levels. Because again, back to most of my presentation, exercise, especially the right exercise, the right duration at the right time, you know, 6, 7, 8 times out of 10 is super effective in treating the symptoms after concussion or mild traumatic brain injury. I hope that answered the question. Yeah, we really just do it on an individual basis. So if you have these certain symptoms, we're going to treat those. And again, I think I've been open the whole time. If you're not getting better and something isn't working, we're going to try and link you up with the people that may be able to get you better. And we have to go back. Thoughts on Bernadette, thoughts on brain freeze, but not the ice cream kind. Can it be mind over matter? I learned how to manage my pain, but my brain is still blocked in areas. I'm not like the brain. Yeah, I'm not. The only brain freeze I'm really familiar with is the ice cream kind. But however, you know, can it be mind over matter? So you learn to manage your pain, but yeah, definitely. But again, depending on the nature of your brain injury and the areas that are damaged, you know, a lot of the times it's not realistic to get back to 100% kind of physically or cognitively. I'm not going to speak on the cognitive portion. My colleagues in OT and psychology and social work would certainly do that. But you know, there's the parts of your brain that are damaged and don't fully recover. You know, the brain can adapt, certainly, but only to a certain extent. So yeah, it wouldn't be uncommon for you to have your pain under control, but you're still having trouble with you know, thoughts and patterns of thoughts and organization and day-to-day stuff. Yes, that can certainly happen.
Oops. And I have another question. Does it work to improve memory? The
PoNS?
Yeah, I believe so.
Yeah, again, this would be one of those ones that's not, you know, it's not on label and wasn't studied. However, I have heard improvements. I've heard anecdotal or individual stories of people's memory and sharpness and clarity of thought improving.
Well, it's interesting. Really, oh, sorry.
Well, what I was going to say, sorry, Melissa, just to build off of that, you know, I know everyone wants a kind of hard and fast rule on, does it help this, does it help that? And really, you know, this is it's a very piece of equipment to be guessing on what it may or may not help with you. So we try and be very clear with that in our complementary consultation. So we would go through some of the symptoms you're having, and if we thought you would be appropriate, and you know, if not, something else that might help you. But you know, I certainly not from a studied point of view, I can't say it helps memory, but I have heard people saying after they finish their program that their memory, they feel like it's better.
Mm-hmm. Yeah, sorry for interrupting like that, but it kind of jogged something in my memory as well. Like when you were talking about so I mean, I've heard about neuroplasticity. It's something that's kind of been around for, you know, quite some time. But and you feel free to laugh at me when I say this, but when you were talking about those synaptic connections, it was like a light bulb, and I thought, is that what is, because as you probably know, you know, when you're learning about development, those synaptic connections are kind of made, and then, you know, usually by like, you know, 5 to 8 years old, it's kind of, that's who you are and off you go. And then when you were talking a little bit, I thought, I wonder if that, because my brain started to kind of go, and I was thinking, I wonder if that's why, you know, CBT works. I wonder if this impacts memory, and I wonder if that's how a lot of those balance and those you know, like gross motor skills are able to be impacted through this. So
great point, Melissa. And to build off of that, so I wish the video showed, but the start of the video basically shows how our understanding has changed. We used to think at 8, 9, 10 years old, and certainly by the time we were late teenagers, early 20s, that our brain was hardwired. It wasn't going to change and didn't have the ability to change. But we've got lots of evidence now that neuroplasticity can happen at any age, you know, on to any age, certainly well into your 70s or 80s. So people have the ability to learn, get better, get stronger, you know, through neuroplasticity, improve the quality of life of their movement, of their thoughts, regardless of age.
That's like, in a way, it's completely simplified it for me, but in a way, it's like, it's opened up so many more questions, and so I'm even more intrigued about it.
Super cool, eh?
It is. Yeah. We have one more question.
I see.
So how does an underlying diagnosis of ADHD impact post-concussion syndrome recovery? The second part is, now I can't tell if my cognitive challenges are related to PCS or ADHD. And to improve my executive functioning, what is your professional opinion about ADHD coaching and or OT along with PT?
That's a good question. The ADHD, again, is a little bit it's certainly out of my scope of practice, and I would refer you to a good OT and psychology and social work that can help work on that. But as far as my opinion goes, that's a challenge we see sometimes. One of the things that's really difficult is having pre-existing, mental health conditions, whether it's anxiety, depression, ADHD. This is the million-dollar question is, for some reason, after concussion or mild traumatic brain injury, the subset of the population that has pre-existing stuff is at a higher risk for developing post-concussive or persistent concussion symptoms. And the golden egg, nobody knows why that is yet. So it would be way out of my scope of practice, but we certainly see that. And yes, they can get blurred. Your symptoms of ADHD, any type of cognitive, memory, attention symptoms you had before a concussion can certainly be heightened. So what's my professional opinion? ADHD coaching, I couldn't comment on that. I don't know that, but I work with some great occupational therapists. We share space with a group called Complex Injury Rehab. I'm happy to pass their information along, but that is really a good start. And then they can assess, treat, and or refer on from there.
Perfect. Okay. And I have. Okay, so somebody's asked, I hope it's okay to ask another question about mindfulness. I had a meditation practice before my car accident, but I struggled to calm my mind and thoughts post-TBI. Do you have any tips about calming racing thoughts besides, my apologies, I have to scroll. Besides focusing on the breath? I walk in nature almost every day. I've started HIIT classes, but insomnia is a huge issue for me too because of the racing thoughts. So it feels like it's harder to recover.
Mm-hmm. That's a good question. That's a comprehensive one there, Charmaine. Let me try and tackle this in a few. Do I have any tips for calming? Really, try. You've got to find the right practitioner is really what it boils down to in my experience. So if you've tried mindfulness, try a couple of different mindfulness practitioners. There's lots of self-directed stuff online. A handful of our therapists do it. There's lots of people that practice mindfulness. It's really finding something that works for you, and it can be a little bit of a guessing game and trial and error. You said you've started some HIIT classes, high intensity treatment or training. But insomnia is a huge issue because of the racing thoughts. Talk to your healthcare professional. So your family doctor, if you have a specialist, you want to talk to them about that. And then certainly reach out, to a lot of the allied health professionals. So try a different style of mindfulness, maybe. We actually have a yoga therapist whose specialty is trauma. I do her class every single morning at 9 on Thursdays. And let me tell you, it seems so simple, but when I walk out of that room and it's a virtual class, I'm just like, it's spectacular. And I never would have guessed that would have helped for me, certainly until I did it and saw the benefits. Bernadette's asking me to do a self-referral. Like, yeah, you can call into the clinic for sure, and we can try and link you up. One of the challenges is a quick one. Everyone's kind of, how do I put this? I'm taking August off. I'm going to be gone for a month. Feel bad. So if you call in the clinic and ask for Kyle, they're going to be like, oh, he's gone for a while. Might be best my email, and I can help link you up with the right health professional at our clinic if you're looking for something in August. Yeah.
Perfect.
We can get the yoga teacher's name. Yeah, it's
okay, let's see, I'll type it in.
well, yeah, so she's on our, this is a shameless self plug. I can certainly type it. So we're Propel Physiotherapy, and which is propelphysiotherapy.com. And our yoga therapist is Jessica Cowan Dewar. And that'll be on our website. And certainly there's lots of opportunity to reach out to our clinic either by phone or email.
Perfect. Okay, and then I have, if I wanted to book a PT appointment at your location, speaking of, is there an option to receive an assessment or treatment with the option of either including or excluding the PoNS?
That's a great question. So the way our process works for PoNS is we always start with a 15-minute complimentary consultation. You can call and book that in. We're in the process. When I'm off in August, it's going to be one of my colleagues that's going to do it. But you know, we start with that, and then what we do after that, if you're still interested, the next step is actually an hour complimentary consultation. We bring you in, we watch you move, we discuss the program in more detail, we talk about the commitment of the program. So you do not have to do anything with PoNS. There's going to be multiple steps before you even get close to it. And then certainly just a physiotherapy assessment is a great start. And that does not have to include anything about the PoNS. And our physiotherapy assessments, if done by most of our providers, are a cost. But you know, given all the pro bono work I've talked about, when I'm back in September, I'm certainly you know, I can help some of you guys out.
Perfect.
I hope that answers your question. Yeah, you don't have to include PoNS. You can call and just say, I'm interested. I heard Kyle's talk, you know, on the BISC webinar. I'm interested in learning more about PoNS. Can you link me up with somebody to talk about it? And everyone at the front desk should be pointing you in the right direction of a complimentary consultation. And if they're not, you've got my email address. And again, keep in mind, I'm going to be off in August. I likely won't be checking this regularly, but I will have somebody that'll be able to link it up. But my email address, should I put that into the chat?
I was just about to do that.
Okay, great. Yeah, it's Kyle, Kyle, at propelphysiotherapy.com.
There you go.
Perfect.
Okay. Just no Kyle in August, everybody.
Yeah, no Kyle in August. You'll get an out of office reply. I promise my kids and myself, you know, taking care of myself. The pandemic has been, we've been working a little bit too hard. So taking care of myself and my kids over August, and I'm gonna check out for a while.
Well, have a great time.
Can't wait. I'm excited. And yeah, I really appreciate the opportunity to talk here about something I feel like I'm passionate about.
It was really great having you, to be honest. Yes, I will repost the email address in one moment. It was really great to have you. And, you know, personally, I loved your presentation. Like I said, I learned, I don't know if I was supposed to learn that, but I learned, you know, such fascinating components to any kind of, like, I guess, across the board neurotherapy, that, like I say, it's so simple, but it's so vast now, you know, and so I'm kind of, I want to do a little bit of research.
Lovely. And always, it goes without saying, you know, feel free to use us as a resource. It's just, it's part of what keeps us going.
Well, thank you. I may have you for another webinar, you know, and just have like some cup of coffee, and we can talk about like neuro stuff like that.
Anytime except August.
Yeah, no August. It's that's it exactly.
Yeah, no problem, Anne. It's my pleasure. Appreciate you taking your time to listen.
thank you to everyone. I'm just, I've learned I can't type and talk at the same time, and so I have to make a decision now. I used to have that skill, and pandemic took that away. But I really wanted to say thank you to everybody. What I'm going to do, because I think that the questions are kind of stopping, what I'm going to do is I'm going to stop recording. So I'll kind of say my goodbyes. But I'm going to finish typing that email into the chat box. And so, feel free to hang on for another minute or two. But for now, I'll just, I'll kind of close it up officially. And I just want to say thank you to everybody for attending tonight. It was a fascinating webinar. I might be a little bit biased. And thank you, Kyle, for coming by and sharing such incredible information and really great resources. It's really, I personally love when somebody really loves not only their job and what they do, but they have a unique perspective where it's more of a holistic. And I know that word is overused, but it's such an important trait in somebody to be able to really just like everything about your person is dedicated to your practice. That's how it comes across. And so it's, for me, somebody like you coming in and chatting and talking a little bit more about, how you are personally in your profession is just, it's so incredible, and it's very much appreciated.
No, lovely.
And I'm certain that a lot of our members feel the same way.
Yeah, my pleasure. Again, it's my pleasure. I enjoy it, and I'm happy to see you guys in, as Jill said, in September or on another talk. I'll, happy to open up my time in September to give another talk. I can talk the hind leg off a donkey and about a million things that I think I know stuff about. So if you'll listen, I'll be here. Lovely.
Thank you so much. I'm going to end this. Oh my gosh, I had a moment. I was like, how do I end it? So I'm going to end the recording. I'm going to say goodbye to everybody, and we will see you next month. Bye for now.
Lovely. Bye, everyone. Have a great rest of the summer.